Doctor-patient relationship in 21st century is something which we all worry about, and I feel that if we focus on, from both sides, a doctor focuses on the communication, the surgical skill and responsibility of taking the treatment from A to Z in today's digital world and today's time when nobody has got enough time to ponder upon their thoughts and look at the positive aspects. I think that's something which is going to kill the doctor-patient relationship big time. We must focus on the positive qualities, positive values in that relationship, because unless doctor and patient come on a common platform, they start having trust on each other, I think treatment is going to go for toss, and people on both the sides are going to be more defensive in whatever they do rather than doing the best for each other.
With the patient and the doctor, this is the only profession where the relationship between the client and the professional like me who provides the service, the discussion is about death. It is no other profession, the relationship is based or revolving around the death. So it's a very sensitive and extremely complex relationship. Now, it is very important that the patient reveals everything what he has without really hiding anything, because we take decision based on what they say. So the most important thing is a trust for this relationship to happen. But there is nothing like, these are the common questions you should ask the doctor, and whatever your problems you narrate without really looking at the consequences. Because if you hide something, you can land in trouble. Like a patient who has a severe symptom of chest pain, they have blockages, but they keep telling us that they have no symptoms. But I can see the relatives sitting next to them constantly trying to intervene, but because of the seniority of the or dominance of the person who is sitting in front of me as a patient, they just keep quiet. So they never hide anything.
Doctor-patient relationship is a very, very tender branch of medical practice. It is a branch of medical practice now, I would say. And something very important when one of a person like you asked me that when a new patient comes, what is the most important thing which you watch? And instantly my answer was connect. You see, you can read a different smile, you can read a different sharpness in the eyes of patient, you can read the change in his expression. When you see he comes and sits with you, talks to you for a few minutes, and you pay attention to your patient, and then you start seeing these changes. This is what I call connect, C-O-N-N-E-C-T. And once this connect develops, then you are the best person in the patient's life and nobody can beat you. But if before developing connect, the patient gets annoyed or suspicious, or he thinks you are not putting attention, these days very common thing, doctors seeing mobile during talking and consultation. This is very suicidal for our profession and it should never happen. So immediately patient would feel very, very saddened, very isolated, and he has no right to express you what he is thinking because he has come to you as a patient. So what I tell to my colleagues, that do something positive. Oh, you have come. Even speaking this much, which does not require any wisdom, it would start connect. And then, oh, this report is better than the previous one, what you had. Connect to the tune of 50%. You are doing very well, 75%. What can I offer you more? What else you want to tell me more? 100% you are connected. Now the patient can discuss personal problem, all problems, sexual problem, depression, everything. But unless you take him onto the right track, patient will go dissatisfied.
Doctor-patient relationship is like your relationship with God Almighty. It's so sacred, it's very personal. You can never breach the trust between the two. And as long as you think it's a very sacred relationship and you know that you have done your best, I think that is more than enough. If you do your best as a doctor to the patient and the patient trusts you implicitly, I think the relationship is on an equal strong pedestal. I've seen that sometimes doctors, being humans, they do make mistakes. But when the relationship is strong, patients can be very forgiving.
We understand that it's easier to treat an informed patient, at the same time a bit difficult to treat the misinformed patient. Patients are pre-educated before they reach our clinics, thanks to the social media and information floating around in Google and other universities. So when they come to us, they are pre-informed. Our job as dentists is to write on a clean slate by erasing whatever information they have. So we tell them, please set that aside for the moment. Listen to what my findings are, what my diagnosis are, what are the options that I give you for your treatment, and then you can pick and choose.
A doctor-patient relationship is a very unique and can be a very rewarding as well as a very profound one for a lifetime to come. Because as a doctor, you receive people who are in discomfort and pain. And what more great opportunity you have given by nature to help somebody recover from their, issues or disability. Unfortunately, in the system of medicine that is being taught to us in medical schools or in dental schools or as healthcare professionals, the human aspect of relationships is never taught, which is actually constituting 90% or more of our care and the recovery of the patient. Unfortunately, today we are all taught just how to do a procedure, how to learn more about a disease or a condition. That's great, we all need to know. But ultimately in practice, you're treating another human being. You're not treating a chair or a computer. So it is very important to develop these human skills. Human skills are not soft skills or hard skills. They are different. Human skills is the ability to listen. Human skill is the ability to feel the pain of the other person. Human skill is the ability to handhold the other person despite any discomfort that you may feel, that you feel that serving the other person is far more important than my own self. That is a very important aspect that a doctor must have. Go and Google, what do patients expect from a doctor? And you will be surprised to see that it is never his degree, never his skill. It is always the patient asking, I need a doctor who spends time with me. I need a doctor who explains things to me. I need a doctor who actually listens to me and makes me assured or gives me that reassurance. And reassurance doesn't come by your degree, experience, or anything at all, or your fame. It comes by you holding that patient and having that ability to connect.
So I can't say that, I can't say that the doctor-patient relationship is single dimension. In fact, it's multifaceted. In certain situations, I think that things have changed for the better, but I can also tell you that things have changed for the worse. In the system now, we are required to tell the patients all the options and allow the patients to choose. But let's be realistic. What does the patient fully understand despite all the disclosure? That's where I find that there may be some limitations in the legal process.
Doctor-patient relationship is deteriorating. Again, I will say due to missing family doctors. If there are good family doctors, this should not have happened, because the relationship with a family doctor is intense and firm and stable. They are the best people to develop that and guide the patients, and there will be nothing happening between a family doctor and patient. The relation will always be secure and safe and strong. And with that kind of doctors, when they refer a patient to this hospital, and if something goes wrong, they will never attack the doctor or hospital, because their trusted doctor only has referred the patient. Now, because of the doctor shopping and patients approaching directly with heightened expectations, and the hospital is advertising too much about their capabilities, finally when something goes wrong, they find that it is a doctor or the hospital that is wrong. They attack without any knowledge about what is going. Actually, no doctor will mismanage a patient. If something happens, it is mostly due to the patient's illness and not due to the mismanagement by the hospital or doctor.
There has been sort of instances, several instances, when this relationship between doctor and patient is gone sour and gone sour in a very bad way, where it can result in even manhandling, lawsuits, or even loss of life. I think a general sort of change of attitude has to be there to go back into that relationship which existed before, where each relationship between the patient and doctor was in the right spirit, which can be brought back with both sides correcting their ways to some extent.